As an emergency veterinarian, one of the most common questions I get asked in the middle of an emergency visit is there anything we could have done to prevent this or caught this earlier? So many times we know the answer to that question is a simple no. But there are cases that with regular preventive care lab work, we might have caught things earlier and been able to intervene prior to winding up in the ER. One of those tests that I have started incorporating for my own dogs, along with at-risk canine patients in the ER, is the IDEXX Cancer DX test, a simple blood test that allows us to identify lymphoma, the most common type of cancer in dogs, sometimes months prior to any clinical signs arising. The best part is you don't need extra samples. Simply include the test in your annual preventive care lab work without any extra tubes needed. With a simple consistent with or not consistent with result, it makes it clear and concise if further medical care is necessary. If results indicate they're consistent with lymphoma, we as veterinarians are empowered to recommend next steps and evaluate further based on what we're seeing with the patient. IDEXX Cancer DX testing is also extensively validated for accuracy, so you can feel confident about the test results you receive. Ongoing medical studies have already resulted in new findings and use cases for IDEXX Cancer DX testing. We just received Draco and Zulu's results back this week, and thankfully they are both not consistent with lymphoma. This allows so much peace of mind for both the pet parent and veterinarian that there is one less thing to worry about. The results had been consistent with lymphoma. It helps prioritize next steps, whether that's additional diagnostics, referral, or client discussion. How IDEXX Cancer DX results can help guide next steps with confidence. Visit idexx.com/interpretcancerdx results or visit the link in my bio.